session. We've come to the end. I'm sorry. I get it. We have two Blooming Health team members are going to come up and we're going to have a little community discussion together. Some of the questions you may have asked, you can look at the QR code and put them in. We're going to be here to sort of have a conversation with you. So if I can have Phil Harker and Kavitha Gnanasambandan come up to the stage. Round of applause is always welcome. There you go. Thank you so much.
All right. Good afternoon, everyone. Thank you so much for staying until the end. But today has been amazing in terms of the very rich conversations we've had. And it's been a wonderful reminder of the power of community and coming together. And especially for me, I've learned a lot about Maryland and the specific challenges and what's happening in the local region here. And it's a good reminder again of health is local. However we define health, I think we talk about food as health, housing as health, transportation as health, and all of those are driven by very regional drivers of health in all of these regions. So for us, traveling the country and building the product for people across the US, this has been very eye-opening to understand the specific challenges and specific solutions that exist in Maryland. I also want to share a quote that inspired me this morning during my walk in Annapolis. And the next slide. And the quote was about from Roots by Alex Haley. It says, "Though we are different tribes and tongues, remember we are all the same people." So Blooming Health is a technology company. We have people from different nonprofits. We have people from government, providers, payers. We all speak different tribes. We are all from speaking different languages, but we're all the same people because we all unite in the same mission of helping people achieve the best quality of life, achieve the best health outcomes. So how do we work together to make this happen has been a key reminder from this event for me. So I'm going to give it to Phil to share the 3 key themes he saw from the event today.
I have more than 3 now since I listened today. But yeah, just to echo Kavitha's words, thank you everyone for coming together. I think it's been phenomenal to hear everyone's opinions, the questions that have been asked, and the panels have been wonderful. But this is a time to kind of debrief and say, what have we learned or what do we think we need to focus on? And I had 5 themes that I heard throughout today. The first was collaboration, which I think this in good part is what we're doing to try to help that, is to come together. The first panel today, we had a health system, a payer, a CBO, and government all on the stand. I don't think they've ever talked to each other ever before, and hopefully they'll talk to each other after this. But the ability to start to collaborate with one another, because the solution to the problem isn't singular in any way, any one party doing it. It's all coming together to figure out how to do it. Which brings me to the second one, which we heard multiple times, which is sustainability, and mainly speaking about the community-based organizations. A takeaway that I heard was we have to figure out a model that sustains these community-based organizations to continue doing what they're doing. Because I venture to think that everybody in this room, in particular, that are part of CBOs probably spend a good portion of their time figuring out how they live to see another day, every day, trying to figure out how we're going to keep the lights on with things other than dreams, I think it was, or something like that in their quote. What was it? Wishes. Well, wishes are my dreams or wishes. But third is interoperability. I think one of the reasons we haven't created an environment that works yet is because there's systems out there that expect everyone to use their system to make it happen, and that's just not how it works. Healthcare has their systems. CBOs have their own systems. Government have their own systems. So there's got to be a way for those systems to talk to each other and share data. We talked a lot about data sharing in that. And so that interoperability is important. And then in the last session, I heard a lot about engagement and follow-up. There needs to be a way to make that scalable so that it's not just constant follow-up by human beings all the time, because that's just not a scalable solution. And the last kind of permeates through everything is health equity, but making sure that we're serving the underserved regardless of where they come from, regardless of what tribe they're from, that we're realizing they're all the same people and that we're speaking their language. So.
Great. I'm glad it grew to 5. Now we want to hear from you all. Like, what thoughts inspired you today? What questions are you leaving with? What ideas were sparked from these conversations for you? Anybody wants to start?
Yeah, I'd love to hear if you're going to leave today and do one thing, what is that one thing you're going to go focus on doing because of something you learned here? Not go to dinner, because I'm sure you'll go to dinner. And by the way, I'm the one from Las Vegas, and so this is very comfortable for me, being on stage with a microphone.
No, but I thought that this information was good, and I think that we'll be able to use it. So I'm looking forward to finding out what it is, these other organizations that we can work with and utilize the vast numbers that you referenced outside that, that will help my organization. Because we don't have the bandwidth to reach thousands and thousands of people. So this would aid us because I said 167 people, but still you can't make the outreach like that just with our bandwidth, because you don't have 167 people working on everything at all times. So this will be very helpful.
That's great.
Thank you.
I'm even more encouraged to go to the MCOs and go to the hospitals and engage them in conversations about partnering, like truly partnering with community-based organizations. That's been a goal of ours anyway, but I'm even more encouraged to do so.
Absolutely. I want to encourage that and emphasize that because I know, Sandy, you mentioned this morning, there's a lot of trickle-down funding that happens today. But what we want to see is more sustainable funding that happens through direct contracting between your organizations and the health plans and them providing recurring revenue streams for your organizations more than just from community benefits, right? And that requires that operational infrastructure, that requires data collection, but also outcomes tracking. I think those are some of the key points that a lot of these panels emphasized is we need to share data with each other because data lives in silos. And when it lives in silos, you don't know the outcomes. I know what services they're consuming, you know what their healthcare cost is, and they know what time and efficiency it takes to deliver them. So how do we put the 3 together to say, this is how this is effective?
I'm excited to help us kind of build capacity. The amount of time we spend on sorting through calls and returning calls that could be directed to someone else, we could really take that energy and that effort and hone in on serving the people that we can serve. So I'm excited about that. I'm excited that we registered. Yes, and I'm waiting for a call back from the team to get us started on that. As you said, there are so many different systems and everybody wants you to use their system. In the state of Maryland, I've been working on a one grant system for 3 years that the state has been trying to do, a universal grant. And the problem is that they can't get all the state agencies to agree on one system. And so to me, this is an indication of being able to do that and kind of really make the best use of our time. So I'm looking forward to that.
No, I appreciate it. I think in the startup world, we say, don't wait for everything to come together, just start doing it. I think when we wait, it takes a long time.
I wanted to pick up right where you left off. So this is an environment in which many of us are living where it's competing efforts to collect data, competing efforts or demands about how we need to answer granting agencies with data. and the idea of feeling often driven by the need to collect data that is taking time and attention and energy, especially of largely volunteer-based organizations where the volunteers really want to be able to connect with people, provide the programming and supports. So I'm walking out of here in that space of, is there a place for the village movement? For volunteer-based organizations who are working with older adults. Looking at Maryland, because we've received Maryland grants, and how do you report on this and all that change. So something that makes it so that this is scalable to every type of organization, regardless of the bandwidth they have and their tech savvy. And that's going to be critical, not just the end user, but also the back end user for this. So just to let you know, I'm in that space of, how does this work? How can we take the next step? Thank you.
That was the goal, to inspire and spark that thought process. Yes.
So just to wrap things up, I want to know how Sam's wife and daughter got back from the hospital. Because the Uber didn't say what time they were going to pick them up, what were the instructions that were left for them, how were they going to get back?
I can actually answer that. So,
It's all in his text message.
yeah, I was gonna say the text message I received says that based on the kind of the hospital's appointment scheduler, looks like the appointment is for an hour. So the Uber is supposed to be 15 minutes after that 1 hour ends in terms of the appointment time, and it's picking it up at X location based on wherever that appointment is. So that all of that, and then during the conversation, actually the agent says that this is a two-way right, meaning that it's taking you there and then someone else is going to pick you up and take you back home, and all of that information comes in a text so that that individual knows, all right, what time, where I need to stand, so the Uber comes and picks me up, basically. By the way, what an ideal world where the plans pay for the Uber Health, so someone doesn't miss their appointment and get into more complex situation, right? Let's make that happen. Like, not always using Uber after a kind of a fun drunk night in the State Street, and more of a Uber right after or before and after a healthcare appointment that people needed so much.
Yeah, but I appreciate the curiosity. That's why we are building the dashboards. So you can see they were picked up, they were dropped off, and they actually made the appointment because your CHW or navigator actually helped them book that, right? That exactly. That's the other one. We should train the AI agent to ask that.
Yeah.
Ideas, inspiration that you received.
Just, I guess it's more of a quick question, is you talked about the system being able to collect all the data and having the data to be able to use to go out and do more fundraising, you know, all that kind of stuff. How does the data come out? Like, is there reports available? Like, what's available in here that will give us the data that can be used to get that funding?
Yeah, I think you're right. Data means a lot of things. What we want to help you deliver is outcomes. So we'll provide the data that's yours in all different formats, as you said. Everything. The answer is yes to all what you said. We'll have dashboards that gives you the visual representation of the trends and the insights on what's happening to the individual and also at the population level, because many of you all work as different sites and different populations. So you'll be able to see the data by those specific populations, starting from the needs to what services were provided to them, and also the follow-up on did they actually go to the service and how are they doing? As a patient, you can, or a member, you can ask them about, okay, we got you food, we got you transportation, we even got you job training. So how is your quality of life at this point, right? So you not just provide the service and the units, but also see their outcomes at the end of it. And so you'll see the full spectrum of data at the individual level, at the population level, in a visual dashboard that you can export, download as a PDF, but you can also download the raw data as a CSV and you can use that. And we can work with you to build the pipelines that are needed to push that data into your systems.
I'd just add one more thing. You know, I'd encourage everybody who's here, and a lot of you here are from community-based organizations, to take advantage. You know, Blooming Health providing the technology, and you may not use all the features and functions of the technology, but we know there's pieces you can use to substantially gain efficiencies in what you do. You know, it's not a grant, but it's our grant, right, to the community-based organizations. And so even if you're not the one that will actually do it or use it, make sure you stop by and just get credentialed. Your company gets credentialed, and someone in your organization can start to look at it, get trained, and then start to figure out how you use it in your day-to-day to gain more efficiencies and gain that level of scale that you talked about earlier. So it's the way I think we're giving back in a way that we believe it'll make a difference to what we're all trying to do.
Yeah, and to echo Phil's point, as Letitia mentioned this morning, and as Lashal, you mentioned, to a lot of grants that you get don't allow you to fund operational infrastructure. We see that gap, right? That's why we started doing it in this way, so we can provide the platform to you at no cost, so that we then together partner with healthcare to fund operational infrastructure, programs, services, and ultimately the outcomes we can deliver together. All right.
Thank you. And
Thank
good
you so
night.
much. Appreciate the time today.
All right. Thanks, Kavita and Phil. Thank you all for sticking around. I think it was a very productive day, a lot of amazing discussions. I want to echo what Phil said. Take advantage of our team here, register your organization. They're going to call you back. You can get training, you can get onboarding, you can start using the platform. And again, you don't need to use the whole thing. Even if parts of it are helpful to you, you can still use them. I think it was a very inspiring day in my view. One thing I want to actually point out is that in the care economy, women are the biggest decision makers for households. I think in our panels today, I actually recognize this pattern. We only had one man presenter or speaker, and the rest were women. Amazing, strong leaders in the community that not only are making decisions around their household and the people they care for, but also the whole community they are serving. I just wanted to celebrate that for a moment because I think this is so important to kind of put your thoughts and intentions on. I want to thank again Governor Moore's team for supporting us in this initiative, for Governor's remarks this morning. I'm personally very energized and very inspired. I think I was here like 4 months ago to meet with the governor. We are back with this event. We're just talking outside. We most probably are going to come back in Q1, Q2 again. So we'll love for all of you to join us again, and we'll report on some of the progress that have been made, and hopefully we can have more of the leaders like yourself to join us and join the kind of the movement we're trying to create. I want to mention something and just close off with that. Most of us in this room have someone in the family that we're caring for or have cared for. Just think of that someone for a moment. For us, every day at Blooming, when we wake up in the morning, like that someone is a driver for us. Because we know the problems we all are solving are like very, very hard. The problems take a lot of energy and a lot of persistence and a lot of patience to actually move the needle and make a change at this intersection of these huge organizations like a state or city government and a large health system and a community-based organizations. So I just want all of you to keep that image in your mind of someone you love that you've cared for or you're caring for, and keep up the amazing work you're doing in the communities. Before I close off, we're gonna have I think a happy hour by the bar here in like 15 minutes. And the reason it's in 15 minutes because they open in 15 minutes, not because we wanted to keep you waiting another 15 minutes. But we're gonna have some small bites and some drinks there. So if you could stick around, we'll love to continue the conversation. More importantly, please feel free to register before you leave so you can take advantage of the platform. And again, thank you so much for taking the time to join us today. I hope you enjoyed it as much as we did. And let's continue this work. Let's continue the dialogue. I don't think we're just getting started. So let's keep up the good work you all are doing, and let's move the needle for the better in the community and especially for the state of Maryland. Thank you so much. Have a great rest of the day.